this is Dr. Ty from Premier Orthodontics, and today I'm going to tell you more about how to wear rubber bands with your braces. If you have braces on right now, there's a good chance your orthodontist has probably already asked you to start wearing rubber bands. So I know at first this seems like it can be a really big and difficult task, but hopefully with a few tips and tricks we're going to show you in this video, we're going to make it super easy and you'll be able to figure it out in no time. So first let's talk about what exactly are orthodontic rubber bands. So the rubber bands look similar to the ones you might find at your local office supply store. The difference is these are designed to deliver the optimal force to your teeth. So they aren't interchangeable with the ones you can find at the store. Most of these rubber bands are made of latex, but if you have a sensitivity, they do come in latex-free varieties as well. You may be wondering why orthodontic rubber bands are even needed at all. So braces by themselves do a great job of straightening your teeth or closing spaces, but things that braces can't do without rubber bands are fixing your bite. Without wearing rubber bands as directed, it might mean that you have your braces on for extra amount of time. Or it could mean that we have to use a different device or appliance, such as a spring or different device that's going to be a little bit bulkier and a little less comfortable than the rubber bands. Or the third thing that might happen is we just can't get your bite fixed and you end up with a less than perfect result. In either case, wearing your rubber bands is the best option and you can avoid all three of these items. Next, let's talk about how often you need to wear your rubber bands and how often you need to change them. So to better understand this, let's talk about how teeth move. If you start pushing on a tooth, it's going to move a little bit, but as soon as you stop pushing on that tooth, it's going to start moving back. So this means if you wear your rubber bands for 1 hour, but then you take them off for 3 hours, basically your teeth have gone back to where they started, and you really didn't make any progress at all. In order to get your teeth to move and stay in that position, you need continuous wear. This means you need to wear them day and night, including when you sleep. We recommend wearing your rubber bands full-time, day and night. You can take them out to eat and to brush, but besides that, you want to have your rubber bands in all the time. Ideally, you should change your rubber bands whenever you eat or brush your teeth. So this means you can change them out at every meal, and you also put a fresh set in right before you go to bed. Usually it ends up being that you change out your rubber bands 4 or 5 times a day. If you're already in braces, you may be wondering when you're going to start your rubber bands. So rubber bands are needed at different stages depending on your tooth and bite problem. Some patients might start from day 1 and wear them almost throughout their entire time in braces. Other patients who may not have that same severity of bite problem may not need braces until towards the very end, or in some cases they may not need them at all. So you should follow the recommendation of your orthodontist. If they've advised you to start wearing your rubber bands, you should definitely get started. If they haven't told you to start wearing them yet, you don't need to worry about it at this time. Next, let's talk about how to actually put the rubber bands on your braces. At first, this is probably going to feel really awkward, but with a little practice and consistency, you'll be a pro. Most patients find that putting rubber bands on your braces is easiest just using your fingers. So using your thumb and your pointer finger, you grip the rubber band, and then you guide that rubber band over top of the hook of the braces. Most of the time patients start with the top braces and then stretch the rubber band down to the bottom braces. For those of you with long fingernails or that just have trouble gripping the rubber bands, we do have this small plastic hook that helps in the process. It's really simple to use. You simply hook the rubber band on the hook and then hook the rubber band over top of the braces and then stretch the rubber band down to the bottom braces and hook it onto that one as well. Most of the time your orthodontist will have these little hooks on hand and will usually give you one, but if you need to purchase one for any reason, you can find them on Amazon, and we'll put a link in the description below where you can purchase those. You may notice that there are different sizes of rubber bands depending on what stage of treatment you're at. So in our office we try to keep it really simple. We use light, medium, and heavy rubber bands. The light elastics are usually used at the start of treatment when you're first getting started. After that, after a period of usually 4 to 6 months, we'll transition to the medium rubber bands, and most patients will continue with those medium rubber bands until near the end of treatment. If we still need some additional bite correction, that's when we might transition to the heavy rubber bands for a short period. Your orthodontist will recommend the size of the rubber bands that's most appropriate for your teeth. One of the hardest things to remember is actually where the rubber bands go and which pattern you're supposed to use. So at your orthodontic appointment, your orthodontist should go over how the pattern should be on your teeth. But in case you forget, we're going to go over some of the more common rubber band patterns that we use in our office. If we are trying to correct an overbite, we'll have the patient connect the rubber band usually on the upper canine tooth, and then pull the rubber band down to the lower first molar. And you can see in this pattern that the elastics will be pulling the upper teeth back and the bottom teeth forward to help fix the bite. This elastic pattern is sometimes called a class 2 elastic. If we are trying to correct an underbite, we'll have the rubber band go from the lower canine, and then you pull it back to the first molar on the upper arch. You can see in this pattern that the elastics will be pulling the lower teeth back and the top teeth forward. And this elastic pattern is sometimes called a class 3 elastic. A common rubber band pattern we will use is a triangle elastic. This is usually done by connecting the rubber band to the top canine, then pulling the elastic to the bottom canine, and then the tooth behind the lower canine. You can see that this forms a triangle. This pattern helps to pull the top and bottom teeth together to help get the bite into the proper relationship. Another rubber band pattern that we use is called a box elastic. This is very similar to the triangle. It is connected to the upper canine and lower canine, plus the teeth immediately behind the canines. This makes a box pattern. This pattern also helps to pull the teeth together, helping to get the bite into the proper position. There are lots of variations of elastics, and your orthodontist will prescribe the precise pattern that you should use for your bite. But hopefully by seeing these elastic patterns, you can better visualize what the rubber bands are doing and why they're important to fixing your bite. So a few other tips and tricks that may be helpful to remember when wearing your rubber bands are: make sure you have a couple bags of rubber bands. We recommend everyone have at least 2, and to keep one at home and then one at school or work. Most of the time we recommend keeping it in your backpack. That way when you're at lunch at school or at work, you can still replace your rubber bands and have them close on hand. If you run out or lose your rubber bands, contact your orthodontist to get a new bag. Most of the time you can just simply stop by the office and they'll be able to give you a new bag. That way you don't have to have any amount of time without your rubber bands. And last but not least, remember that wearing your rubber bands full time, day and night, and changing them 4 to 5 times a day is the #1 thing you can do as a patient to make sure that you get the best treatment result possible. Thanks for watching the video. Hopefully you found this helpful. If you still have any questions at all about rubber bands, feel free to leave a comment below and we'll answer those as soon as we can. And remember to make sure to subscribe to our channel. If you found this content helpful, give us a like and hit that bell for notifications for when we release new content.